Okay, thank you and good afternoon, everybody. I hope everybody had a pleasant weekend, got some time outside. So as you'll see in a few moments here, our regional numbers continue to slow and steadily decline, a sign that the majority of the population is following our social distancing, masking, and sanitizing guidelines as those set forth by the CDC. With that being said, the virus is still out there and we're not out of the woods yet, but it's still a positive sign that we're continuing in the right direction. We still have to be very mindful that it's not time to relax, and I continue to urge everyone to work to keep each other safe and healthy. So one of those ways is to continue those things that we've been talking about for quite some time now. There's very good evidence showing that one of the very best ways to decrease the risk of spreading virus is to wear a mask when you're out in public. But this only works if everybody is doing it. And so from my being out and about over the weekend, I've noticed that most people are following this simple and low barrier tool. So let's make sure we can get everybody involved in this. Another reminder, if you think you've been exposed to the virus or if you're feeling ill, isolate yourself at home and away from others. Now with that, let me share our current updates, and I'd be happy to take some questions from the news media afterwards. So here again is the chart showing our hospital admissions, and it continues to show nice progress. Again, it shows that the trend in daily new hospital admissions since early April. Now, we've seen one of our lowest numbers yet on hospital admissions, with just 15 admitted on Saturday. So remember that it's a 2-day lag on hospital admissions. And this takes our 7-day moving average down to 19, which is, again, another new low. And this is continuing an important trend and an indicator of the level of suppression of the virus in the community. We want to see it continue to go even lower and stay as low as it can as we move our way through the next phase of reopening and even further than that. So our next slide is our hospitalization data, and this is COVID positive and suspected COVID patients, or patients under investigation. And the blue line is our rolling average line, it's 7-day rolling average. So today's rolling average is 363, and it continues to decline. It's been as low as it's ever been since we began tracking the data. And our overall hospital census decreased from last week as well. Today it's at 331, which is down from above 400 last week at this time. And so again, we continue to see some steady progress, continued downward trends, and we want them to stay as low as possible. So let me show you the numbers now that we normally show. As I mentioned, we had 331 hospitalizations today of confirmed COVID and suspected COVID patients, and that's up from 321 yesterday. But again, we don't follow those day-to-day fluctuations. We look at the trends. And last week when I was standing here, we had 415 patients, and so we've taken quite a significant drop. We have 78 confirmed COVID and suspected COVID patients in our intensive care units, which is down from 86 last week. And we have 53 confirmed COVID and suspected COVID patients on ventilators today, and comparing that to a week ago when we had 62. So again, all of our numbers continue to show nice progress over time. And our good news slide. So yesterday, our task force healthcare systems discharged 3 additional COVID patients, bringing our cumulative total to 2,287 since our first confirmed COVID patient in the region. And in a week since we had our last briefing, we've discharged 162 patients from the same time period last week. So that's all great news. And that's really a testament to our healthcare workers who have helped these patients get better and be able to go home. So thank you to our healthcare workers. So in summary, the progress in this region has been really incredible. We've been keeping the right measures in place, helping us prevent spread while we continue to gradually reopen our economy and people are out and able to move around more. Now, we'll keep a really close eye on the data as we make decisions during the next phase, make sure we're keeping track of community spread and the number that are infected. And right now, we'll go ahead and finish up and take some questions that we've received from the media. Thank you.
With the rise of group gatherings, many in close proximity masked and some unmasked. Are you concerned there will be a rise in cases due to recent protests in and around the St. Louis area? And a follow-up to that is being outside to make any sort of a difference?
Yeah, so, let me talk in generalities. Anytime that you get more people together in a more confined space, it's always going to increase your probability of the risk of transmission. So, with that being said, I think the questioner is right. Some have been masked, some have been unmasked. If people are going to be participating in activities like this, would prefer that everybody be masked so that you can protect everybody around you. Practice as much social distancing as you can. Use some hand sanitizer, things like that. But in answer to your question, anytime you get, regardless of if people are protesting or if they're doing any other activity, people that are in close proximity to each other are at higher risk of transmitting virus. So yes. The second part to that question, being outside, does that impact the ability to transmit virus? And the answer is yes, it does. And so we're always much more concerned with indoor confined spaces than in outdoor spaces. And that's because you usually have more room to separate in outdoor activities. You get the benefit from the UV light. We're not sure how much of a benefit that is on the coronavirus right now, but we believe there is some. And also the dispersal of virus from aerosolized from talking and things like that also is a benefit because it is able to sort of dilute the amount of virus, and so the odds of becoming infected diminish quite rapidly when you're outside as compared to a confined space. Now, some of the other things that I think are put you at more risk is, of course, if you're speaking loudly or shouting, you're going to be dispersing more aerosol, which is why it's important to wear a mask so that you can protect people around you from spreading aerosol. And so, but being outdoors is generally considered a more safe place for viral transmission than an indoor confined space.
Okay, that was our only question for today. Thank you for watching. That concludes the list of questions received from members of the media prior to and during the briefing. Thank you for tuning in.